Hello, guys. This is Rayo Ronaldo, and part of this video. Purpose of this video is to give testimony and also to go ahead and give some advice, especially if you live in North Carolina. Um, Let me explain what just recently happened to me. I had gone for an MRI, and it was on the day of my daughter's graduation, and I had gone in for an MRI, and what ended up happening is that it was at 9 o'clock. And when I went in, everything's fine, hunky dory. I get out just in time to see the live screen of the graduation, see her walk across the stage in a happy way. It was so cool. I had just gotten out in time from the MRI to see it. It was great. Um, what ended up happening is that um, got out by 12. I think I saw her walk about 11 o'clock. And I had a 2 o'clock appointment um, that afternoon with the cardiologist. So I went to the cardiologist's office. And when I went there, I felt itchy. I feel strange, whatever. So I asked permission. I said, "Can I take off my shirt and y'all just take a look, see if anything unusual is there?" Well, I took off my shirt and poof, I was hyped up. I was messed up, dude. And once I got messed up, oh my gosh, it was hyped up and everything. They asked, "Well, what different did you do?" And I said, "I just went for MRI." So what ends up happening is they're like, "Okay, there's a reaction to the MRI, which is fine. Um, we need to send you to urgent care." Go downstairs to urgent care. Urgent care and the clinic is in the same place. And went downstairs and whatever. When I went downstairs, oh my God, dude, there was so many sick people in there. Young kids, I mean, just spewing out stuff. I didn't want to wait in that lobby, so I said, "Can I wait in the lobby of the building, the open area?" I said, "Yeah, we'll call you from there." They did. And so, they offered Benadryl and a prednisone shot. And, I didn't think the reaction was too bad because I had worse. So I declined the prednisone shot and should have said yes, by the way. And went ahead and said, "I'll take Benadryl when I get home because I got to drive. Benadryl makes you sleepy and messes you up, so I don't want to take it right now." So that's what I did. When I went home, I did the Benadryl. And then it's crazy because Saturday, the next day, 12 o'clock p.m., um, I start coughing up blood, difficulty breathing. Now I'm thinking bronchitis because of the fact that I went to Little Ebola land in the urgent care. I said I probably picked up some illness from there because them folk was sick as hell. It wasn't that. It was all part of the reaction. I didn't know. And really, honestly, and truly, cardiologist should have just sent me directly to the emergency room. In retrospect, so you look at stuff after the fact. Yeah, you should have been in the emergency room as soon as you had the hives, and you should have got a shot and taken care of an emergency room. But I didn't. It happens. Whatever. Not just my mistake, their mistake, and urgent care's mistake too. But anyway, continuing. What ends up happening is that, oh my God, I get so sick. Then on Tuesday of this, a couple days later, I end up going to a urology appointment, and they said, "You can't be here, dude. You look sick as hell. I know you're saying you're gonna go to the emergency room after, but we have to stop this clinic visit right now. You have to go to the emergency room." And I went. I went to the emergency. They wheeled me down to they helped me get into the emergency room, which is fine. And of course, I got admitted. I mean, um, just was in bad shape, but they admitted me more so under a cardiac admission versus a medical admission for allergic reaction, which is that's where I disagreed with them anyway. Uh, Let me say this: UNC Rex, it's a great hospital. UNC Rex has an emergency room. I've never seen this thing in my life. I've never seen this thing in my life. Is that, dude, these emergency rooms in these big cities are now homeless feeding shelters, drug addiction shelters, and sleepover shelters. Here, let me give you an example. There's one stall, handicap stall, male handicap stall. So what ends up happening is this. I see this guy, he gets his medical band, he checks in, whatever, and he goes into the bathroom. Now I'm watching him now, don't get me wrong. And I know there's only one handicap stall in there. There's only one toilet. The rest are two urinals. So this dude stays in there over 3 hours. Dude, he finally comes out about 3.5, 4 hours later. There's no way he could be listening for his name to be called while you're in a stall. So basically, you're using the emergency room to go ahead and chill out, have a place to lay your head down, and a place to go on the internet. That's it. So you're in a handicapped stall with your computer, your laptop. Went in with his laptop, so I'm going, his laptop is it? It's like, well, who the hell does that shit? Wasn't in his book bag. No, he had it out and he's going in there and he stayed in there. Here's a problem. I had to take a piss. I was waiting for that bathroom. By the time he came out, I waited like 5, 10 minutes before I went in to make sure he was done. And guess what? I didn't make it because I waited too long, so I had to change my clothes, whatever. But anyway, that's not the gist of it. Gist of it is this: while I'm in the emergency room, each and every time I've been there recently, is these homeless people, same characters come in just about every time I'm there, and they get meals, and they go under. I'm sure they got some sort of underpinning, like severe medical condition that they keep coming back to the ED for. But it's also, when I go to the ED room, it's like a Jerry Springer taping / cops taping. One guy was he said coming into the building, "I just want to go into the bathroom and change my clothes." He was a homeless dude. And they refused to they denied him entry. But then outside, right outside where we could see clear as day through the glass, like cops show up and all this other stuff. And I don't know what if he was trying to change his clothes out there or whatever, but it's just a cops episode, Jerry Springer's episode every time. And unfortunately, most of these EDs are now overwhelmed, um, especially at Rex. It's just overwhelmed with patients, and ED is not big enough to handle. Let me give you an example. Duke forever has been, Duke ED has been forever the least used ED, because they, from the get-go, say you gotta have a mask on. They limit your guests from the get-go. So they've always had that. Not only that, they limit that. When you go to visit people upstairs, they have severe limitations, so that ED tends to be less crowded than most. Rex is a little bit more crowded. They take on people. It's crazy because I see they're overwhelmed and they're accepting patients from other hospitals. I'm like, how the hell? You're overwhelmed by yourself and you're accepting patients from other places. That's just crazy. Anyway, what ends up happening as a result of all this, the MRI reaction, contrast reaction, I get admitted. And part of it is heart failure means that you have to diurese. Diuresis means that your heart's not pumping hard enough, and it allows overflowing, an overflow of fluid to build up in your body. Basically, my extremities start to swell up, and I start to look like a watermelon after a while. If I don't get rid of the fluid through diuresing, diuresing is just taking a pill that causes your kidneys to go into overdrive. Once your kidneys go into overdrive, they pull out the excess of water. But not just water. They pull out nutrients, electrolytes. They pull out potassium, magnesium, chloride, and stuff like that. So when you're diuresing, which is what they admitted me for, along with, they were also giving me, prednisone antibiotics for a pneumonia that I ended up catching, and for the reaction. The pneumonia is from the reaction to the MRI contrast. Basically, the MRI contrast attacked my lungs and my heart and caused pneumonia. So they would treat me for that with IV antibiotics, along with diuresing, which is getting rid of the excess fluid from my body. But here's the thing. They take your blood at about 6 in the morning. When they take your blood at about 6 in the morning, when you're admitted in the hospital, they want to, replace your whatever potassium you lost. So 6 a.m., the blood work comes back about 8 a.m., 9 maybe. They look at it, they say how much potassium they got to give them back, and whatever other, electrolytes / nutrients. Well, the workers at UNC Rex are awesome, professional, well-rounded. They're great. They're great workers, but they're overwhelmed. So they got this little system, a little communication system around their neck, while they're in one room taking care of one thing, they'll get like 6 calls about other things to do, from telemetry, from this, that, and the other. It's like, they don't have pen and paper. How the hell could you commit that stuff to you while you're wiping someone's ass or giving them medication? How the hell are you going to keep track to go to another room to fix their EKG, to go to another room to make sure someone gets on the toilet? I'm like, all these calls are coming in to these overworked workers, and they're wonderful people. I love them to death, but I can see they're overwhelmed. They're just overwhelmed. So if you ask them, can you come back at 8 o'clock to help me brush my teeth? They don't come back to about 10 or 11 o'clock at night, or 12 if they remember. And so they forget. And one basic thing is this, when you're in a hospital, you can't get out of bed on your own. Otherwise, those alarms go off. Well, so I call for help. I say, look, I got to take a poop. Call for help, take a poop. First of all, first time I called for help that evening was called for help because they moved I was coughing up phlegm so bad. It was good, like Ghostbusters phlegm. The glob and stuff. And the x-ray person came in. move my barf bag, my spit up bag, to the other side of the room. So I hit the button to get someone to come in. No one ever came. And that was the first instance. Second instance is that like 30 minutes later, I had to go take a poop. So I hit the button again. Hey, look, I gotta take a poop. Nobody comes. So guess what? End up taking a poop in the bed. Not something I want to do. I mean, you know, if you can't get me to get on the toilet and shit, I need to be going home. Whatever. If you can't get me to even get a barf bag, because even with the barf bag, when no one came, I pulled the towel that I was laying on and started putting all the phlegm on there. It looked disgusting, and I left it on the service tray table, and dude, it was disgusting. And when the attending nurse that evening heard that I had left that towel there, she like, and it was, yeah, it was full of gook, all this phlegm. And then she asked the male CNA, she's like, "Did you touch that towel? Did you dispose?" He said, "Yeah, I put it away, put it in the dirty clothes." And he's like, "I had gloves on." She's like, "He's got an infectious disease appointment. It might be contaminated." Like, dude. She was going off on the poor dude. And dude's like, "I did my protocols." And he did his protocols. But the main story is this, is that I ended up taking a poop in the bed. And since no one was coming, I laid the head of the bed down flat, started pulling myself up so I could angle myself to pull the poop from under me. I angled myself, and then when I did that, oh my God, I set off the bed alarm. Once you set up the bed alarm, oh my God, everybody and his cousin comes. EMS, fire department, NSA, everybody comes. NASA came, everybody. I mean, everybody comes out the woodwork when that bed alarm. But if you hit the bed alarm for anything else, for regular service, I need a cup of water. Forget about it. They just overwhelmed. They just so that darn overwhelmed. It's not even funny. Good people, again, I'm saying good people. And Rex is one of the better hospitals. Over here in North Carolina, Raleigh, I would label as Wake Med being the worst hospital. Everybody agrees with that I've talked with neighbors and whatever. Wake Med, both Cary location in Raleigh, being the worst. Next up on the list as worst is Duke. One of the better ones is Rex. And I think they said another better one was UNC Chapel Hill, whatever. I haven't been out there, so what ended up happening is this, is that at about 6 p.m., no, about 5:30, 6 p.m., they came in with all these swabs and stuff like that and tests, whatever. Now, when you come into an ED and you tell them that you're coughing up blood, well, they're supposed to test you for COVID and all this other stuff, COVID, RSV, flu, and all those other wonderful things, tuberculosis. They never did that in the ED. A couple days into the admission, just before I left on Thursday night, all of a sudden they come with all these tests, like about 4:30, 5 o'clock. So then I'm feeling weak and feeling disgusting and then really tired. I wasn't sure why, but I'm like, I'm not feeling right. So I told them. One of the CNAs came in about 6 o'clock, 6:30. She said, "I'm gonna give you a bath. I'm gonna come in half an hour. No, about 5:30. I'm gonna come in a little bit and give you a bath. That I promised you earlier and I couldn't get to you." I said, don't come because I was so weak I couldn't eat. I was so weak it was just crazy. Um, and so I said, no, don't come. And while I'm talking to her, they calling for her to give it back to someone else. I said, go take care of that dude, that person, that patient. I said, I'm too weak to do this stuff right now. And I was. So later on, about 7:30, 7 o'clock, I go ahead and check for the results. And the results had come in from all these rapid tests of RSV, flu, I think about 8 o'clock, whatever, 8:30. But then I noticed something. I noticed that my chloride level was off. My blood levels were shot up like crazy. CO2 level was up in my blood. All these levels were messed up. But most importantly, potassium. I was missing potassium. I said, that explains why I'm weak. So I got pissed as hell. I said, stop the IV drip with the Lasix to get rid of fluid. Stop it right now because you're taking out my electrolytes. You're taking out my potassium, my magnesium, and you're not replacing it. They hadn't given me the medication for that day. And this is like 9 o'clock at night. So then the nurse realizes the mistake at about 8:30. The one that took over from one shift to the next. And the other shift was just overwhelmed. That's all they were. They just overwhelmed. They just didn't get to it. But this other nurse came in. She said, now I can't give you the potassium and stuff. Now we have to run stat blood work. They ran stat blood work. I told them, pull this IV out. I'm stopping. I don't want you to take out no more treatment right now because you're not replacing the stuff that I need. And you're not replacing them. And I'm about dead. So she did. She pulled it, stopped the trip, whatever. And I was pissed. I'm like dying right there in the daggone hospital room from not getting potassium and stuff that my body needs. So I got pissed. So then I rapidly ate the food. I had some Ensures inside my book bag. Some Ensures, some granola bars, whatever you call it. Shit. I ate that to get my potassium level back up. By the time the lady came for the blood work for potassium, about 45 minutes to an hour later, I had eaten and taken in a whole lot of stuff to build my potassium back up, and I was getting a little stronger. But I didn't know until I checked my own blood work. That's crazy stuff. And they missed it altogether. That's even crazier. And I was half dying right there, and I was at risk of death right there inside the hospital. And it's just because they're overwhelmed, that's all. They're good people, professional. I wasn't treated badly by anyone. They're really good people. They just, that communication system that they got, and they don't have enough workers. It's like having NC, North Carolina Fair traffic, state fair traffic, and you're using the regular staff, weekday staff to handle it, and you can't do that. Absolutely can't do that. You got to hire additional personnel if you're going to accept additional patients, and you got to match them. And they're not. They're not hiring and have the personnel to meet the needs of the patients. So you just got too few workers and too many patients. That's unfortunate. That's my point of view. All this is my point of view. All this is my subjective perspective. Okay, so the next day I leave. I'm pissed off, but I had asked several times, can I meet with the internal medicine person that's treating me for the pneumonia? Got denied. Can I meet with, can you get urine test done for my urologist that asked for a urine test? That didn't get done. can you go ahead and send someone from discharge planning to my room so I can make informed decisions? No one came from discharge planning. They called them and everything. And the nurse that was on duty that morning, she's like, had the medication for the day, IV medication for pneumonia available right there on the little workstation. For about an hour, hour and a half, it was out. But she kept getting called out the room with this little freaking intercom system. So she can never get her thoughts right, never could do her work because it's just too much communication. Too much, you can't keep interrupting someone's train of thought. Eventually, they just gonna go ahead and lose track. And that's why I'm literally looking at a person being overwhelmed and losing track repeatedly, more than one worker. So what ends up happening is this: all this medication is there, IV medication for the pneumonia and stuff, and they didn't administer it. Didn't give me but potassium for the day either, or whatever. What they did, I don't remember. I think the potassium may have been taken care of. But what ends up happening is this: is that I get pissed. I said, I'm leaving then. I'm gone, because it's like, if you're so overwhelmed that I'm almost dying in your room, I don't need to be here. So I get pissed. And so when I start talking about discharge against medical advice, AMA, oh, now that we know you're doing AMA, we're not going to let you see and talk to anyone. Okay, well, you didn't let me talk to anyone before, and now for sure you're not going to let me talk to anyone, because now you know I'm going to do an AMA, a discharge against medical advice discharge. Oh yeah, now you ain't going to talk to no one. We ain't going to give you no medications. We ain't even going to help you out the door. You have to figure out how to get out of here and get to your car. Like, holy shit. Ooh. So you're not going to give me no prescriptions for the moderate to severe pneumonia I have? Nope, you get nothing. You're not going to let me talk to the doctor? Nope. Ooh. That's rough shit. That's rough stuff, big time. So I ended up leaving. Let's get this out, I'm gonna get the heck out of here. They wouldn't help me even, so I got dressed and I left. What ended up happening is this, and I had to figure out how to get out of the building. Mind you, this is a new hospital part that I had never been a part of. I didn't know that the complex was so big. It had two hospitals, had a main hospital and a heart hospital. First time I've been to this other hospital. So what ends up happening is this: is that I leave, no prescriptions, whatever. Now, mind you, I got moderate to severe pneumonia, pneumonia that can kill me. I'm leaving the hospital without antibiotics. One of the things that end up happening, which I kept telling us, that look, I'm a homeowner, and I got other issues at home. Part of being a homeowner is this: is that I saw on the cameras that the grass was way over 4 inches, was in fine territory, get a fine at any moment, whatever. Or they could come cut it at any moment and issue me a fine. Come cut it. So I said, look, I gotta go home to cut I don't have supports like that. I don't have, a grass cutting service to come. I'm the grass cutting service, me and my son. So I had to go home to cut the grass, whatever, and did that and take care of some other business. But here's the thing: at minimum, I should have been able to have antibiotics to keep taking to see if I can finish knocking out the pneumonia. Oh no, they refused to give it to me because I'm AMA. So that means, guess what? Once I take care of everything when I got home, that means a guaranteed visit to another hospital. And I did. But here's the thing: I went to the rich people hospital, Pinehurst. Oh my God, hospital. More Memorial Hospital. I think they call it First Hospital up in Pinehurst. 2 hours away from my house. And the reason why I went is because my niece had gone there, got admitted. They treated her so well. They did such a thorough job. It was awesome. So I go over there. Here's the thing. When I go to the ED at Duke or UNC Rex, you're talking about a guarantee 12 to 16 hours of just waiting to be seen, and also for these blood tests, whatever. Guess what? When I went to Pinehurst, I was the only patient there. They were waiting for patients. Only patient there in ED, accepted me right away. Was in a room within 10 minutes. Actually, 5 minutes. Was in a room within 5 minutes. Within 4 hours, all the necessary tests, CT scan, blood work, everything was done. And they found stuff, like I had a UTI that I didn't know of. They asked for stuff that the other hospital didn't. They did the swabs immediately. And so they took care of stuff more thorough in less time. 4 hours worth of time. By the 8th hour, I was up in the room. Within that 4 hours, I had my own room in the ED. Immediately within 5-10 minutes, I had my own room in the ED. And I stayed in that room until I got a room upstairs. Oh, I mean, it makes a difference when in 4 to 8 hours, you can have all the tests done and results would come back and get admitted and get treatment. They agreed to admit me for the IV treatment for the pneumonia. And that's the only thing I would agree to. I didn't agree to no more diuresis. They wanted to, but I said, hell no, I'm too weak for that crap. So I declined, but I did get IV treatment for the pneumonia, and they checked. They say, did you realize that a UTI? I said, no, the hospital didn't even check the urine. Even though I asked repeatedly, they checked the urine. Never checked it. And what ends up happening is that to continue is that they looked at the blood work. They say white blood crowns, when it came down, whenever it was normal, my kidney function came back to normal. I almost had kidney failure from the other hospitals, mishaps, according to more anyway. First hospital, whatever. First health. It's 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 a better experience. Oh my God, dude, the food was better. I mean, my first meal there, one of my first meals was a breaded chicken, homemade macaroni, like Southern black people, and collard greens. Oh my God, that stuff was so good. Oh my God. Their breakfast, I had leftovers from their breakfast. Not at the other hospital. The other hospital gave you barely enough to eat. This other hospital, oh my God, it's like, yeah, we fatten people up here. That's for sure. And we use Southern cooking there. That's for sure. Oh my God, let me say this too. The room, someone, architect, designer, builder, whatever, they faced the room, the whole building, with the windows towards the sunset. So when the sun comes setting, the room fills up with sunset colors. and you can see, because the building is higher now, you can see the sun going down over the mountain. It is so beautiful, whatever. Food awesome, people great. But not only that, they had the time. They weren't overwhelmed. They had the time to dedicate to look at every aspect of the patient. And they did methodical approach. And they found stuff the other hospital missed. And I'm just saying, when you're overwhelmed in the city, having to deal with the homeless folk, there's a consequence. Your staff is getting overwhelmed. And that's the unfortunate aspect. I say this only to say that First Health Hospital, Moore Memorial is great. If you, I'm just saying, if you have the opportunity and you're in an emergency room and you're having an emergency, but you don't want to, you want to ensure that you get quality care, you might have to do the 2-hour drive to a place like Moore Memorial Hospital. It's a country hospital that's got everything in it, though. I guess because of the rich people use it. I think they even have a special golf cart entry with special golf carts with red lights and blue lights and stuff like that. I'm just kidding. It's just to let you know that sometimes you have to go out further. But here's the thing: in Duke, they got some good doctors too. Their orthopedic department got great doctors, but that doesn't mean the cardiology department sucks and some other stuff. They got great equipment at Duke too. They got super duper fancy stuff that Rex doesn't have. Rex doesn't have it at all. So they got certain equipment that Duke Rex doesn't even have. So when you're looking at different services, remember, just because a hospital may get a bad rap, that doesn't mean everything is bad about it. You just got to find the right doctor, the right person, and have a responsive doctor. Like, I got a good cardiologist, Dr. Edel Octon, over there at Rex. Better than the Duke guy. The Duke guy was crazy. And it's just, and I know the people at First Health, they on their stuff. They got everything all wrapped up and together. So just, if you don't want to wait 12 to 16 hours in the taping of Cop slash Exorcist slash Jerry Springer at the city emergency rooms, then you might need to go to the country to ensure you get quality care. It's a pain in the butt, but it is what it is. Right now, just to let you know, the diagnosis is kidney cancer along with heart failure. So I get weak. I'm not doing too well at times. But God is good, because who the heck would expect just to go through an MRI and almost be half dead? I didn't expect it. I expect to recuperate from the last. I had a bladder infection. The bladder infection is because of controversy between the cardiologist and urologist. Urology says you have to drink more water, flush your bladder and stuff. Cardiologist says no, you can't drink that much water because that'll cause you to be on fluid overflow. And I asked for them to talk to each other, and they don't. Here, the last admission, I was asking that the wishes of infectious diseases and urologists be, I asked them to do a prostrate level test that the urology wanted. And I asked them to do urine tests. And in the ED department, when I was being admitted at Rex, they had the urine, they didn't send it in for analysis, as I asked. It's unfortunate because even in your own hospital, your doctors don't talk to each other. That's just unfortunate, but whatever. It's not a multidisciplinary approach. It's a territorial approach. I'm urology, I'm cardiology, whatever. It's just crazy. Like one thing that ended up happening is during one admission, I was pulling on Jardians. And when I went to the urology appointment just before being admitted, she said, how the hell could the cardiologist put you on Jardians when Jardians changes your urine to pure sugar? And once it's pure sugar, you got the highest probability ever of getting UTIs. Like, you're kidding me, right? No, you're not supposed to be on Jardians at all. Oh my God. And then, of course, the urologist gets on infectious disease. Infectious disease, first urology department, urologist group that I had was from Urology Associates. The guy looked like a dope when he came to the hospital room. And he had the opportunity to run an MRI to see if the bladder infection moved to my prostate. Didn't do it. Infectious diseases did order the MRI, and we're following up. But here, then this last urology appointment. Well, urology is like infectious diseases can't order MRIs on prostrates and stuff like that. That's against the rules. Damn, y'all in the same hospital and y'all fight against each other. That's my problem. God bless. I'm just saying, if you find a doctor that listens to you, stick with it. If you don't, keep on moving, look for another. And be in charge of your own healthcare. Follow up. And, when things going wrong, ask why. And then look for the answers. God is good. God is great. In the midst of all this, He kept me. Stuff that you would think, how the heck did all that happen? God is good. God is great. And He kept me. God bless. Hope this helps. Remember, Rex is great. But if you want the best, more Memorial up in Pinehurst. They just have a little bit more time, less staff that are overwhelmed. They just got the right balance of this. God bless. Rex is a great hospital, but overwhelmed. Duke, Duke is another, God forbid if you end up with an airway med. Take care. God bless.